Hi, everybody. I'm Dr. Ferris Carter. I'm the Chief of Infectious Disease at MCHC. I've been in practice since 2003, almost 19 years. And I'm here to talk to you about different topics in infectious disease, but mainly COVID-19, known as SARS-CoV-2. So as you all know, we've been in this pandemic over 2 years now. This is our third year. This all started in March 2020. However, there have been cases worldwide dating back to December 2019 and January 2020. However, in the US, we start seeing cases around March 2020. So, COVID 19 is a disease that has consumed our life for the last 2 to 3 years. And what do we know about it? Where are we now and where have we been? So, 2 years ago, we saw a patient with COVID 19. We freaked out basically. We isolated the patient. We gave them treatment that we have at the time. The only treatment we have was IV remdesivir, which at the time was not FDA approved. We did not have any outpatient therapy for COVID-19. We just treated the patients with vitamins. We treated them with melatonin to help them sleep. Sometimes we gave them steroid dose pack and antibiotic packs, which now we know they don't work and actually they might be harmful. We admitted the sick patients to the hospital. We gave them treatment in the hospital. IV antibiotics, IV remdesivir, IV steroids, oxygen. Some of them went to the ICU, some of them didn't. Some of them got discharged from the hospital and followed with us as outpatient, and some of them never made it. It's a bad disease. However, the breakthrough was in December last year, a year ago plus, December 18 months ago, where the vaccine came to par. And as you remember, the first people who got vaccinated were healthcare workers, which is us, and teachers and people who are essential workers. The vaccine was very scarce. We all jumped on the vaccine, and people who wanted the vaccine took the vaccine. Elderly, patients with low immune system, healthcare workers, first responders, teachers. So we have this big demand for the vaccine in December, January, February, 2 shots. I'm talking about the Pfizer and the Moderna. And we did really good. In February, the numbers started going down, the infections started going down. We felt some ease. And we had another spike of COVID-19 after that. As you all recall, we dropped our masking too. And we had the Delta variant that came and swept us through the whole summer. Through the whole summer of 2021, we were busy battling the Delta variant of COVID-19. And we got to a point where people who are vaccinated, and people who are not vaccinated, they're not vaccinated. They don't want the vaccine. It became rumors, and it became storytellers, and it became political, and it became personal. And honestly, we spent a long time convincing our patients to take the vaccine. Some of them did, some of them didn't. But what do we know now? We all know now, 2 years and almost 2 months into this, that people who took the vaccine did really well, 99%. Within exceptions, people sometimes didn't do well despite taking the vaccine, but it is not the vaccine, it's the comorbid conditions, being obese, morbidly obese, hypertension, high blood pressure, diabetes, coronary artery disease, low immune system. People who have other medical problems that, on immunosuppressive therapy, very high dose of steroids. Despite the vaccine, these patients, sometimes they don't do well. However, we finished the Delta variant, and that was last summer. And we took a small break. And in the fall and this December, November of 2021, the Omicron variant came in. And that's what we have right now, the Omicron variant. We started with a variant called BA1, and now we have BA2. And if you have been listening to the news, there is BA3 and BA4 in Europe and other countries. So COVID-19 is still here with us. I just came here to talk to you guys, and I got here a little bit late. I was in the hospital seeing COVID-19 patient. We have right now 4 patients in the hospital. A month ago, we had 0 patients. Today in the clinic, I gave our outpatient treatment for COVID-19 to almost 5 patients. 30 patients, 30 this week, got outpatient treatment. We have 2 new medications, actually 3, that we can give patients pill form. One is called Paxlovid, which is the Pfizer pill. It's really effective, 90%. 3 pills twice a day for 5 days. You have to start it immediately after you get diagnosed, within 5 days. The other options we have is a Merck pill called Molnupiravir. We don't use that one unless we run out of the first one, because the first one is better. Molnupiravir is 30% effective. And for patients who cannot take both, because there is a lot of drug-drug interactions with the Pfizer pill, we're still giving them the monoclonal antibodies in the hospital, which is an IV form. So we do have treatment for COVID-19 right now, outpatient, without being in the hospital. The key is to get diagnosed soon and get treated. And how can you get diagnosed soon? You've heard about the government giving home tests. Everybody should have home tests. You get sick, you do your home test, it's positive, it's simple. You call your doctor, which is us. You can do a telehealth without coming to the clinic and spreading the virus. And we can give you treatment by talking to you by telehealth. However, even now in 2022, we're in June now, the vaccine is still the best protection we have. If you ask me today, what is my main message during this lecture, or during what I'm talking, is be vaccinated. Please be vaccinated, because the vaccine is the best way to stay away from the hospital, away from the clinic. Yes, you can get COVID-19 if you got the vaccine, but you'll be fine. You'll have a very mild illness, maybe a cough, maybe a snotty nose, but that's it. If you're not vaccinated and you have COVID-19, you're going to be really sick. I'm going to tell you about a small caveat here. There are some patients who have low immune system. They cannot develop immunity to the vaccine, especially if they are on heavy chemo or immunosuppressive therapy, like for Crohn's disease. These patients are, on antiretroviral therapy, AIDS patient, they cannot develop antibody to the vaccine. So we do have another monoclonal antibody that we can give you a shot in the arm called Evusheld, Evusheld, made by AstraZeneca, and that will give you passive immunity for 6 months. So if you are a person who are a renal transplant patient, a liver transplant patient, or a heart, lung transplant, small bowel transplant, who cannot produce immunity on the vaccine, call us. We can offer a monoclonal antibody shot that will give you protection for 6 months. And after 6 months, you can get another shot if COVID-19 is still going in the community. So we've come a long way. Remember, I told you in March 2020, we had nothing. And now we are in June 2022. We have vaccines, mainly the Pfizer and Moderna vaccine. We don't give too much Johnson & Johnson anymore because the other two are better. We have a shot we can give you if you cannot develop immunity to the vaccine, or if you are allergic to the vaccine, called Evusheld. We have treatment that we can give you in the outpatient setting, which is Paxlovid, Molnupiravir, and a monoclonal antibody in the hospital called Bebtelovimab. And don't worry about the name, just remember it as a monoclonal antibody. And if all fails and you have to be admitted to the hospital, IV remdesivir right now is FDA approved for the treatment of COVID-19. And we're still giving steroids, dexamethasone mainly, and we give you also a shot of Lovenox, which is a prophylactic shot so you don't get the blood clots. So to make a summary about all what I've talked, COVID-19 is still here, it's not gone. Yes, we dropped our masking, yes, we dropped our barriers, but we're still seeing patients that are sick with it. If you're not vaccinated, get vaccinated. If you are vaccinated, get boosted. If you are boosted and the age is above 50, if you're above 50, get another booster. If you have a low immune system and you're vaccinated, get your 3rd shot, because immunocompromised patient needs 3 shots. Kids from 5 to 11 needs to get vaccinated, because kids are important. They give the infection to the adults, and kids between 11 and 18 should get vaccinated. To wrap it up, get vaccinated. We have treatment for outpatient. We have treatment for inpatient. If you're allergic to the vaccine, we have an option. I'm going to say 1 minute about things we should not forget, because COVID-19 is here. We should not forget about hepatitis C. We are number 1 state in the country with cases of acute hepatitis C. I see hepatitis C every day. I treat hepatitis C every day. It is a silent killer. Go to your doctor. If you are between the age of 18 and 79, get a hepatitis C test. If you're positive, we can treat you. If we don't treat you, over 20 years, 10 years, it will cause liver damage that can lead to problems. It can cause liver cancer. The last thing I want to say, HIV. We should not forget about HIV. I've seen many cases with HIV in the last 6 months that have been forgotten because of COVID. If you are between the age of 15 and 64, you need an HIV test one time. And even if you are less than 15 or more than 64, who's a high risk factor, you need an HIV test as well. There is a treatment for HIV, 1 pill a day, keeps the virus suppressed, and you live long time. Thank you for having me. If you have any questions, call us. If you have anything you want to discuss with us, come to the clinic and see us. If you cannot come to the clinic due to transportation issue or to gas issue, because gas is expensive, we can do it telehealth. Thank you and have a great day. Bye-bye.